I'm the cardiac poster child of the American Fire Service. I'm alive today because of a firefighter physical. I had a condition that I didn't know was going on, and that condition would have affected me and may have killed me, and certainly could have affected my crews and my community. That evaluation made a huge difference in my life, and without that, I'm not here. It's critical that you take the time and you as a leader help your departments get those firefighter physicals to make a difference in the crews that we have that are protecting our communities across America.
There's a lot of discussion about cardiovascular disease in the fire service, and it's really quite a complex topic to what causes cardiovascular disease, how do you detect it, and how do you prevent it. We owe it to the fire service to make sure that we're evaluating firefighters for the early detection of cardiovascular disease so that it can be managed. The fire service has a responsibility to prevent cardiovascular disease as much as possible, but also to identify it early enough so that a firefighter can respond with lifestyle changes or medication to mitigate the risk.
I think annual medical evaluations are a must for all firefighters. Not every firefighter gets them, but it's so important to have that early intervention, early prevention, to understand where your risks lie, and so you can pay attention and notice when things are slipping.
When we first started the cardiac prevention program here, a lot of firefighters had that concern that their information will be shared with the upper management. And after a while, they realized we do not share that information with anybody except for the doctors at the occupational health clinic here, the cardiology group at Hopkins, and the patient's primary care doctor. Even the safety officer do not have any access to the results. It is extremely important for firefighters to get their 1582 compliance physicals annually, the surveillance, because that is when we examine their family history, past medical history, social history. We cover all that on top of also doing a stress test. We also check their labs to see if they have any of the risk factors that are modifiable. You know, we check their vitals, we check their blood pressure, lipids, kidney function, liver function, you know, exposure history. And so based on all the information, we are better able to address any kind of modifiable risk factors so we can focus on prevention.
So here in Howard County, we have something really great. We have our occupational med facility, which is Corp OHS. We've developed a really great rapport with all the physicians and the staff here, and we understand together that firefighters don't want to be pulled off the floor. They want to go back to work. So we work together to make sure that they are healthy and safe and are able to go back to full duty.
And then when they're in the clinic, I put all of this information together and compare it with basic risk factors, but then individualize it for each firefighter so that they know, these are the risk factors that I have to be concerned about. And then ultimately, we talk about action plans for what can you do then to reduce those risk factors.
An occupational medical evaluation is designed to identify anything that might lead to sudden incapacitation of a firefighter. And that means we must focus on cardiovascular disease, because as you know, the leading cause of line of duty death is cardiovascular events. One of the greatest concerns expressed by firefighters is that a medical evaluation is going to find something and take them off the job. Happily, that's a very rare occurrence. But in direct contrast to that fear, what we actually find is that firefighters who undergo medical evaluations identify problems early so that they can correct them and stay on the job, and then actually enjoy their retirement as well.
When their medical results come back, all we know is fit for duty or not fit for duty. And not fit for duty, and they've been referred. Who they're referred to, we don't know, unless they reach out and say, hey, can you help me because I don't have a pulmonologist or I don't have a cardiologist. The docs work with all that.
For firefighters who do not have access to a work employer health department or occupational health clinic, they should always follow up with their primary care physician, have an annual physical exam, make sure any of the modifiable risk factors such as high blood pressure, cholesterol, diabetes, obesity are addressed by their primary care doctor and are adequately treated. Those personnel should also make sure that they avoid alcohol, eat healthy, and exercise.
In these cases, it's really important to work with physicians so that they understand the work of firefighting, the environment in which it's performed, and the physiological strain it places on the individual.
The cost for firefighter death and disability far exceeds the cost of a cardiovascular disease prevention program.
I am a better firefighter because I went through that process, and I'm eating healthier, and I've got the do the physical workouts and make sure that I take care of myself. The firefighter physical saved my life. We need to get that message out to volunteers, to career firefighters across the nation and across the world. Early detection, early intervention can make a huge difference in your life and your life beyond your career as a firefighter, whether it be volunteer or paid. Don't look at these things as affecting your career or affecting your volunteerism. Look at them as long-term corrective processes so that you can perform better and live longer.
When you're requested to do an evaluation, we're doing that for your health, to keep you alive. We're not doing it to take you off the unit. I don't want to fill my office with modified duty firefighters. I don't. And when it comes to volunteer corporations, your chiefs don't want you off the units. They want you riding the units, but they want you healthy.
The occupational medical evaluation gives us the opportunity to identify cardiovascular risk factors. Now, it's a tremendous lost opportunity if we identify an elevated risk factor and then we don't follow up and manage it properly. And actually, it's a real tragedy when we identify a risk factor, it's not followed up on, and then we have a line of duty death not because of a lack of a medical evaluation, but the lack of follow-up on the findings of the medical evaluation. One of the misconceptions I often encounter among firefighters is the thought that being cleared for duty means everything's okay with their cardiovascular health. If you go through a medical evaluation and the physician indicates a problem, high blood pressure, high cholesterol, excess obesity, and counsels you to see your primary care physician or to follow up on this condition, it's essential that you do so. To give you a quick analogy, think of a 360 size-up on the fire scene. Your goal there is to identify risk so that you can mitigate them. You can't safely ignore the findings of a 360 medical size-up any more than you can ignore a size-up on the fire ground. You must manage the risks that are found. But it's important that you have an occupational medical evaluation to ensure that you can safely and effectively perform your job. But during an occupational medical exam, the healthcare provider might identify a condition that should be followed up. And it's not the job of the occupational physician to do that. In other words, they don't treat conditions like hypertension. Instead, they refer you to your primary care physician. A primary care physician does the follow-up on conditions. So it's two different types of medical evaluation that work together.
Firefighters do have to understand that they're not just putting themselves at risk. If you go down on the fire ground and your crew has to pull you out, you're putting everyone else and their families at risk.
And I think the chief officers in the volunteer ranks in America are seeing the difference in terms of the cardiac problems that we have with our membership. And they're seeing the difference of what we could do to change behavior. Chief officers have to make difficult decisions for the betterment of the community and the betterment of their crews. And that's what you have to do.
Every firefighter should get a proper medical evaluation so that you can do the job you love to do. and do it safely. A medical evaluation is like a 360 medical size-up that allows you to identify the risk and then mitigate them so that you can stay on the job for a long, healthy, and effective career and a wonderful retirement.